Good morning, everyone. I'd like to welcome everyone to Health New England's Medicare Made Easy, the ABCDs of Medicare. We certainly appreciate you taking time out of your morning to learn about this topic. And quick introduction, my name is Kerry Trotta. I'm one of the Medicare plan specialists for Health New England. I'm a licensed health insurance representative. And as I mentioned, we certainly welcome your interest this morning. What we'll be trying to do is go through the various aspects of Medicare and try and break down these pieces, perhaps make it a little easier to understand what Medicare covers and what Medicare does not. So, with that, we'll go ahead and get started. One quick side note, you are seeing a bar somewhere on your screen. And what we ask is we will run through the entire presentation. However, I am available. Normally, we like to address questions towards the end. So you are seeing a Q&A area. I believe everybody has been muted, but towards the end of the presentation, when we open it up, please feel free to write some of perhaps your general questions. We will also be providing direct contact information. So if you find you have some very individualized questions, again, I will provide you with my contact information and whenever it may be convenient for you. So we start with original Medicare. And Medicare is a federal health insurance program. It's available to individuals that are age 65 or older, also for folks under age 65 with certain qualifying disabilities. And Medicare is also available for anyone of any age with the medical condition of end-stage renal disease. This is a form of permanent kidney failure that requires the individual either is going for dialysis or perhaps a transplant. Now, the two components of this federal health insurance, you have your Medicare Part A portion, and this piece specifically is designated to cover your claims if you are admitted into the hospital on an inpatient basis, skilled nursing facilities, inpatient rehab, and certain hospice and home health care services. The second piece of original Medicare, Part B, is designed to cover your outpatient claims. So, services such as physician office visits, outpatient surgery and tests, preventative services, and again, some home health care. Now, we do encounter folks that are receiving their Medicare Part A, and most of the individuals we speak with do not pay a monthly premium for their Medicare Part A piece. As long as they have satisfied enough quarters here in the United States, which comes out to 10 years or 40 quarters, they can receive their Part A upon turning 65 at no cost to them. Now, oftentimes when they do receive their Part A, if they are to be admitted into the hospital, most folks would like to know what type of bills or leftover balances will I encounter. So the information that we're sharing today is specific to calendar year 2022. However, each January, Medicare updates their numbers. And if this is information that you may be in need of, again, we will be providing contact information. I can send the new information for 2023. But as we talk to folks again that may indicate I've just received my Medicare Part A, and whether they have a scheduled inpatient stay or they're admitted perhaps through an emergency room and they wind up inpatient, it's important to know that they do have a Part A inpatient deductible. For 2022, the inpatient deductible is $1,556. This inpatient deductible applies whether I'm in the hospital just one night or if I should be in the hospital up to 60 consecutive days. Now, the next question that often arises, do I pay this deductible each time I'm admitted throughout the year? And the answer depends on when the last time you were inpatient. So, as an example, perhaps someone is in the hospital admitted, whether it's a couple nights or perhaps a few weeks. They will come out, and for 2022, they will have their 1,556 deductible. And now, let's say 2, 3 weeks, maybe even a month later, they wind up back in the hospital, whether it's for the same condition or another condition. They would not be responsible for another deductible because there must be a 60-day break in between hospital stays for that deductible to apply again. Now, we also mention for those few folks that may encounter a hospital stay that is longer than 60 days in a row, days 61 to 90, Medicare Part A does place a per day fee of over 300 and some odd dollars per day that begins to kick in. Days 91 up to 150 is over 700 a day. Now, again, it's a small percentage of individuals that would need to be inpatient, let's say 3, 4 months, but we just want folks to be aware that if you are inpatient longer than 60 days in a row, days 61 going forward, you will now begin to have per day fees. Everything we're discussing would be for an individual that is strictly using just their Medicare card. Now, the second piece of Medicare, the Part B, your outpatient coverage, this piece does involve a monthly premium. If you are collecting a Social Security check at the time that you sign up for your Part B, Social Security will automatically withdraw your Part B premium on a monthly basis. The majority of individuals that we've encountered in 2022 are being quoted roughly $170.10. But we do tell individuals this is based on your annual gross income or your last 2 years' tax filings. So for individuals that gross over 91,000, their Part B premium will be in a higher bracket than the 170.10. We always refer individuals back to Social Security directly so that they can quote you what your monthly Part B premium will be. Now, again, if we're speaking with someone that has just received either both pieces, A and B, or perhaps just their Part B, maybe they've worked beyond 65 and are now just taking their Part B due to losing employer group coverage, and they're using this outpatient coverage for the very first time, they do have an annual deductible to satisfy. For 2022, the Medicare Part B deductible is $233. After someone satisfies this Part B deductible, then Medicare Part B will pay 80% of Medicare's allowed amount for that visit or service, but always leaving the individual with a 20% leftover balance. Now, certain preventative services may be covered at 100%. Now, we mentioned the Part B premium calculator, and certainly one of the questions that we often encounter, as I mentioned, is I'm not sure what my Part B premium will equal. So again, this chart is indicating your Part B premium calculator. In addition to this chart, I meant to mention at the beginning, If someone would like, certainly a copy of today's presentation, either emailed to them. I believe we have a listing of the various addresses, which I can send out, or again, I'll be providing my contact information. You will be welcome to jot down my email address and send me a request if you would like any additional materials or this particular presentation. Now, looking at this chart, again, you can see they are quoting you as an individual, filing joint, or filing married with a separate tax return. It looks like we may have a quick question, so I'm going to just open this up for a moment. And we have someone asking, please explain the difference between in-network and out-of-network for a PPO. For snowbirds who would be using doctors out of state, would this be considered out-of-network for a PPO? And the answer normally would be yes. However, there are certain plans that make adjustments in PPOs. I'm going to go into a little bit more detail on this as we move through the presentation. So please allow me, what I'll do is I'll continue going, but I am going to address something called a travel benefit with our particular PPO right towards the end of the presentation. Now, original Medicare and adding some additional coverage. So the chart that you're seeing in front of you is basically capturing the three main ways we see individuals using their Medicare coverage. At the top, we certainly have folks that will use their original Medicare card and only this card for their medical insurance, just their Part A, their Part B, and certainly would be subject to whatever the balances are that Medicare leaves them with. But it's important to know that the red, white, and blue Medicare card does not include Part D prescription drug coverage. So many times we see folks certainly using their Medicare card for health insurance, but then they do have to go to an outside private insurance company to purchase their Part D prescription drug coverage. Oftentimes, individuals will indicate, I've received my Medicare card, but I'm waiting for Medicare to mail me my Part D prescription drug coverage. Unfortunately, Medicare does not offer the Part D. They do set the federal rules and guidelines, but you do have to purchase Part D prescription drug coverage through a private insurance carrier. The next area that we see folks or scenario using Medicare coverage, again, using their Medicare card as primary, purchasing that separate Part D drug coverage, but some folks may be nervous as far as the balances that the Medicare Part A and Part B may leave them with. So they will purchase a secondary coverage called a Medicare supplement or a Medigap plan. And that's exactly what it does. It comes in after Medicare makes its payment and can help pick up the balances depending upon the plan, the supplement plan that they choose. So some folks, again, are using 3 different cards. The last scenario we see folks using Medicare is something called a Medicare Advantage plan, or they're also referred to as a Part C plan. You certainly do have to have both Medicare A and B to join a Medicare Advantage plan. These plans are only through private insurance companies. But unlike the supplement that works with the A and B, the Medicare Advantage plans temporarily, while you're on them, take the place of Medicare. So you place the A and B card away. The Advantage plan is now the only card you're using. And instead of going by Medicare's deductibles and remaining 20% balances, you now go by the set copays under the Advantage plan that you choose. Normally, when we indicate this, the next question that tends to come up, well, if I'm only using the Advantage card and I've tucked the Medicare card away, am I still required to pay the Part B premium? And the answer is yes. You still continue to pay your Part B to Social Security. Again, you tuck this Medicare card away because Medicare is no longer paying your claims. The Advantage plan is now solely responsible. Many times, the Advantage plans, the Part D drug coverage is built right in. So we often refer to these Advantage plans as very similar to employer group plans. We let individuals know there is no right or wrong, basically based on what the individual feels, what type of coverage they need, with the understanding that every year I can make a change in my plan. Now, original Medicare and Part D prescription drug coverage. So, as I mentioned, there are basically two ways to enroll in this Part D prescription drug coverage. And again, if you're using your Medicare card, you must purchase a separate drug plan. But if you purchase an Advantage plan, you're not actually allowed to purchase a separate drug plan. You must choose an Advantage plan that has the Part D built right in. These Medicare Part D prescription drug plans must follow specific guidelines that the federal government sets. Now, again, every year the government updates the Medicare Part D prescription drug guidelines. The information we're seeing here, again, is specific to 2022, so this information would be updated for 2023. Every year, as I said, the government sets the phases and numbers. So for 2022, the government has advised the insurance carriers that offer Part D, you can place up to a $480 pharmacy deductible. That doesn't mean every Part D plan places it at $480. That's up to the individual carrier. Excuse me. Then Medicare sets what's called a coverage limit. For 2022, the initial coverage limit, or we tend to refer to it as a spending limit, is $4,430. This is similar to an imaginary bank of money given to you right when you take the Part D drug coverage, whether it's in January or if you start the plan mid-year. And as folks go on a monthly basis and fill their medications, perhaps they have a pharmacy deductible first, and then in this phase, they're normally paying whatever their copayment is. So, as an example, perhaps someone picks up a brand name medication and they pay, let's say, their $45 copay. It's important to know it's not the copayment they hand the pharmacist that gets subtracted from this bucket. It's what the actual full cost of the medication is with the carrier. So again, somebody is purchasing their med, they hand their $45 copay, but the pharmacist sees the actual cost of this medication is $350. It would be $350 for that one medication that's subtracted from this bucket. Every time the individual is filling a medication, whatever the true full cost is being deducted. You can see for individuals perhaps that take very expensive medications or quite a few medications, they may not have enough in this coverage limit to last them the entire year. And perhaps if someone does use this coverage limit up mid-year, and they enter what's called the next phase, which is referred to as the coverage gap, or in past years used to be referred to as the donut hole. If someone enters this next phase, you can see they're no longer paying the copayment they were previously paying. Now, if it's a brand name drug or a generic drug, they're asked to chip in 25% towards the actual full cost of the medication. If someone is receiving additional help, perhaps through what's called LIS, through Social Security, this phase is removed from them. But other individuals that enter this gap now see an increase in the amount they're asked to pay for each of their medications. There are many folks, important to note, that do not use up the full coverage limit. Some folks do, perhaps towards the end of the year. And so they may have just a few months they're in this gap paying higher amounts. But other folks, again, enter this gap much more quickly based on the cost of their medications. And in this gap, if someone is to satisfy out of their own pocket $7,050, that includes any deductible they paid, any copays they started with, and any percentages. And perhaps it's now the fall and their statement indicates I've truly paid $7,050 in medication costs. Well, now I come out of the gap and enter the last and final stage called catastrophic coverage. This is where my copayments now drop down, or I'm chipping in 5%, whichever is the greater amount. As I mentioned, each January, these numbers are updated. So for 2023, some of these numbers have increased. It's important if you are shopping for a Part D plan, some of the questions that folks may want to ask: what does this Part D have for their deductible? The coverage limit will be the same, the gap chipping in 25% the same, and the catastrophic out of pocket is the same for all Part D. The Part D carriers do get to determine, however, what copays they're going to charge and what medications they're going to place on their listing. These are things that folks look at each year as they're shopping or if they're newly eligible for Medicare. Now, there is something called a Medicare Part D late enrollment penalty. We explain this because, again, in speaking with individuals as they're shopping or looking around, many times folks may indicate upon turning 65 or taking their Medicare that they are not going to purchase a Part D drug plan because perhaps they don't take medications, or the medications that they do take are generic and very inexpensive. Well, Medicare does mandate that folks carry Part D drug coverage unless, however, they have a veterans benefit, military, TRICARE. These folks have another avenue to purchase their Part D prescription drug, or their medications rather. So the government indicates you're exempt. You don't have to purchase a Part D. But everyone else technically is supposed to be carrying a Part D plan. For those individuals that we encounter that perhaps don't take it when they're retiring or have signed up for Medicare and no longer have their employer coverage, and perhaps they wait a year, 2, 3 years, and their circumstances change and they now need a Part D plan, perhaps they're taking medications or more expensive medications, the government does assess a monthly late enrollment penalty. The way the penalty is calculated, they take whatever the national average is of a Part D plan by itself. And right now we say a Part D throughout the country, an average one is about $32 a month. So the government takes 1% of that, 32 cents, and they times that 32 cents by the number of months or years the person has skipped taking a Part D plan. Whatever that dollar amount is now their monthly late enrollment penalty. Unfortunately, it's not a penalty, a one-time fee the individual pays. The way it stands right now, it's a lifetime penalty that's tacked on. If folks feel there is a qualifying reason as to why perhaps they weren't even aware they needed to carry Part D, this is something they can appeal through Medicare directly. But oftentimes we do see individuals, as I mentioned, that were not aware they were required, unless again they are exempt and have that VA benefit, TRICARE, Indian Health Services. That's where the government says you certainly can purchase a Part D, but you're not mandated to. Now, original Medicare, as we mentioned, purchasing a separate drug plan, but I'm someone that wants help with what these balances are that the Medicare card will leave me with. Now, supplement plans, as we mentioned, you do have to have A and B. You also, not just for folks 65 or older, but individuals that are under 65 that have a qualifying disability other than end stage renal disease, they too are eligible for supplements. As we mentioned, Medicare, your primary payer, supplement plan, your secondary payer. Also important to know, as I said, depending upon the supplement you choose, the state of Massachusetts does allow the carriers to offer 3 variations of supplements. Another piece specific to supplements, I can use any doctor or hospital in the United States as long as they accept Medicare. So you won't receive a provider directory or booklet with a supplement plan because it's a national network. Again, excuse me. Again, though, must go find a separate Part D plan. Now, throughout the United States, most of the states offer supplement plans that range from something called a Sup A plan through a Sup N. Thank goodness here in the state of Massachusetts, it's been made a little easier because we only offer 3 choices or variations of supplements. If you are a resident of Connecticut, you do see the supplement choices range from A to N, but Massachusetts does not follow that rule. Now, eligibility. We say there are 3 supplements to choose here in the state of Massachusetts, and really anyone with Medicare A and B is eligible for the core supplement or the supplement 1A. However, the supplement 1, the last plan you're seeing, is a grandfathered plan, and it is only available to individuals that were eligible for Medicare prior to January 1st of 2020. Now, Medicare Supplement Core, this plan is going to pick up some of the balances that Medicare leaves, but not all of them. You're still responsible for your inpatient deductible if you choose the core plan. Still responsible, for skilled nursing copayment per day fees after 20 days. And you're still responsible for your Part B deductible. The supplement 1A is going to pick up your inpatient deductible, skilled nursing, still responsible for Part B. And then the supplement 1 is going to pick up all the various balances that Medicare leaves. It is extremely important to note, however, if you're purchasing any of the supplements, supplement plans only pick up balances of services that Medicare allows. And oftentimes, when I indicate that, individuals will ask, can you give me an example of something Medicare will not pick up? The answer to that would be a full hands-on routine physical. Medicare Part B will cover what's called a well care visit, and that's certainly where you speak with your physician, review records, medications, symptoms, but it's not a hands on exam. So when someone schedules their full routine physical and they have Medicare A and B, and perhaps they've purchased one of the supplements, they end up getting the denial from Medicare. Physician sends it to the supplement to see if they'll pick it up, and the supplement denies it as well, saying not a covered service under Medicare. So there are very few things that Medicare does not cover, but the two main that come to mind would be a full hands-on routine physical and a routine eye exam. Now, there are certain benefits that any supplement must pick up. First one, must pick up per day fees after 60 days. Must pick up the 20% leftover on your outpatient Part B services. They must cover the first 3 pints of blood each year, Part A hospice balances and copayments, and must follow any state of Massachusetts mandated benefits. Now, we switch gears completely. We're no longer talking about supplement plans that work with the Medicare card. We're talking about Medicare Advantage, Part C plans. And again, as a reminder, these are only through private insurance companies. They do have to be approved by Medicare each year. They cover your Part A, so they're going to take care of you in the hospital by copayments. They cover your outpatient Part B services, again by copays. They have added the Part D drug coverage right in. Most carriers offer what's called PPO plans that allow you in and out of network, or HMO plans where I'm got to use providers within the network for my scheduled services. The criteria in order to enroll in an Advantage plan, well, I must have both Medicare A and B, but most Advantage plans do require that the individual reside within certain counties. They're not like the supplements where you can live anywhere in the state of Massachusetts. Now, some of the highlights: many Advantage plans may start with a $0 premium. Again, you are paying your Part B to Social Security, but you may find there are many plans that offer you their Advantage plan at no monthly premium. Again, PPO plans, HMO. Some plans offer what's called an HMO point of service, POS, or a private fee-for-service plan. These plans have yearly out-of-pocket maximums. Individuals are still responsible for co-pays when they're seeing their providers or using various facilities. Most of the time, as I mentioned, if it's an HMO, you do have specific areas where your in-network providers are. However, most plans cover you for worldwide emergency coverage. So even if you're in, let's say, an HMO and you're traveling within the United States or even out of the country, you are covered for emergency and urgent care. You, in turn, are just responsible for whatever your copayment would be. Many Advantage plans also place additional extra benefits that the original Medicare does not cover. Things like over-the-counter items, some dental reimbursements or allowances, fitness, Weight Watcher programs, sometimes some discounted hearing aid coverage, eyewear, home delivery meal services after folks have been inpatient. These are just a few. Now, important considerations to think about when I am shopping around or trying to choose a plan. Again, based on my specific interests and needs, perhaps I am someone, again, that travels quite a bit. I may want to certainly ensure that I do have emergency and urgent care coverage. Maybe I'm someone that actually, again, lives out of the service area certain months of the year. So I may want to ensure that I have more than emergency and urgent care. Some folks may have established physicians out of the area. Um, do what type of additional benefits are important to me? Is certainly monthly premiums are a factor. Looking at my total cost. Perhaps I'm someone that likes to know I have an out of pocket maximum, kind of a safety net that in the worst case scenario, this is the amount I would pay within a year. Again, what doctors are important to me? Are my current doctors within the network? Are my medications covered by this plan? What co-payments are they charging? Do they have a pharmacy deductible? And if so, what is that deductible? Again, we already mentioned the additional benefits. What is my access to customer service? Um, are folks available to me? These are just some of the brief questions that folks begin to look at as they begin to determine what type of plan it would be rather the best fit. Now, when and how can I enroll in these Medicare plans? Well, as we mentioned, and just a quick recap, if you are approaching age 65 and you are collecting a Social Security check already, you will automatically be enrolled under Medicare A and B. But if you are not collecting Social Security and you want your Medicare A and B upon turning 65, it is up to the individual to call or go online or visit your local Social Security office to advise them you do want your A and B. And you can start that process up to 3 months before your 65th birthday. You also have 3 months after turning 65 if you weren't sure about taking A and B for your 65th birthday. They will allow 3 additional months. Now, we also know that there are folks that may delay taking their Part B. Most folks will sign up for their Part A right at 65, even if they're continuing to work, because again, there isn't a cost. They may hold off on the Medicare Part B because perhaps they're working for another year, two, however long, and they're keeping their employer group coverage. Well, when you are getting ready to retire, losing an employer plan allows you to go back and sign up for Part B, and in turn allows you to jump into a Medicare Advantage plan or supplement plan. And these are the time frames we just mentioned. So we have something called the initial election for folks that are brand new turning 65 or have just been awarded disability. We mentioned they can start 3 months before and have 3 months after. But if you are someone that is not electing both pieces at age 65, well, there is also something called the general enrollment. This period is specific to folks that perhaps signed up for their Part A, they held off on their Part B, not because they're working or they have other coverage, they just didn't sign up for outpatient. They have only been carrying Part A for a while. Well, Medicare says you can't sign up for Part B whenever you want. You don't really have a qualifying event. So now you have to wait for something called the general enrollment, which runs from January 1st to March 31st. For 2022, the Part B is then effective for July 1st. These are folks that may incur what's called a late enrollment for Part B. But we see this very rarely because most folks know either upon turning 65 or when I'm losing employer group coverage, I need to have Part B outpatient. So occasionally we see an individual go without this for quite some time, only having Part A. Now, annual enrollment, as most folks are aware, every fall we're seeing the commercials, the mailers. Between October 15th and December 7th, anyone with Medicare A and B can make a change in their plan. They can make a change between October 15th and December 7th. However, the change doesn't actually take effect till that January. They can move certainly from one Advantage plan to another. They can add or drop Part D prescription drug coverage. They can have an Advantage plan and determine they no longer want that style plan and they'd like to enroll in a supplement and purchase a separate Part D drug plan. Again, they can buy up or down, but any change they make does not take effect till that January 1st. Now, we've already discussed a little the loss of employer group coverage. Quite frankly, one of the most common that we've seen in the last few years. Individuals working beyond age 65. Normally, most folks will sign up for their Medicare Part B for the first of the month after their employer group coverage ends. But it's important to know that you can't just call Social Security or go on their website and elect the Part B. If you are retiring and you are beyond the age of 65, there are specific forms that must be completed. One is a beneficiary form that the individual completes. The other is an employer form that the employer is required to complete. Together, the two forms must go over to the individual's local Social Security office. And you always want to start that process a good 30, 45 days before you're losing your employer group coverage, just to give Social Security time to enter your Part B. The individual then has 60 days from the loss of the employer group coverage to jump into a Medicare Advantage plan. We normally encourage folks not to be enrolling in COBRA coverage upon leaving an employer group plan because of certain penalties that may take effect. You can see if you're leaving an employer, technically you do have 8 months to sign up for your A and B or your Part B, but you only have 60 days after your employer group coverage to get in these plans. So you certainly would not want to wait more than the 2-month time frame to be signing up for your Part B. Now, other special enrollments, it's important to know if I'm in one of these Advantage plans and I originally signed up. As we know, there are residency requirements, and perhaps now I'm moving to another state. Well, I'm entitled to a special enrollment when I move to my new state to look around and choose a plan that fits my new area. Again, leaving an employer-sponsored plan, that triggers a special enrollment regardless of the time of year. Moving into or out of a long-term care facility, nursing home, this triggers a special enrollment. Individuals that qualify perhaps for a low-income subsidy or mass health, qualifying for what's called a state pharmaceutical assistance program called State Prescription Advantage. Or if a Medicare Advantage plan is rated as a 5-star plan, individuals can move from their carrier to that 5-star plan. Again, if you have questions on other special enrollments, we refer individuals back to Medicare directly to see if it may be a qualifying event. Now, tools to help you shop to make these decisions. Well, we always refer folks to the Medicare.gov website. Oftentimes, folks may indicate I'd like to check my medications for various carriers. So there's an area that they can key in their medications specifically. This also gives you a brief description of the various supplement plans and advantage plans, what those copays may look like. Medicare and You booklet. Anyone that has Medicare A and B normally each January receives, or prior to January 1st, a Medicare and You booklet. Again, which goes into the various plans available in their area and any new Medicare updated rules and information. You certainly can work with the individual carriers with a sales representative or an insurance agent, or many times local senior centers have what we call shine representatives, where they can cross compare several plans to help the individual determine what type of plan and which plan may be the best fit to start with. Now, again, agencies, resources. So again, the Medicare website, phone number, Social Security questions, state health insurance assistance plans, prescription advantage, which again is not a Part D plan. It's specific to the state of Massachusetts. We always encourage individuals to double check where they may qualify for assistance, especially if they do take expensive medications and may determine I am going to be in that gap. There are 5 different levels of help there. And then how to contact us. So I mentioned at the beginning, my name is Kerry Trotta. I'm just one of the Medicare plan specialists for Health New England. I've indicated my desk phone here, my cell phone, my email address. I also am showing my sales manager, Sarah Fernandez, my coworkers, Carla Figueroa, Lee Jagai, who tends to handle our Berkshire area, Fern Silva, and Michelle Eldridge. Just go a little further here. Then we also like to, if you are specifically looking perhaps at a Health New England plan, whether it's a supplement plan or an advantage plan, or even if you're just looking for general information, we're placing our sales queue phone number, our website, our online, or again, if you have very general questions, we have a Medicare email support box. And normally, this is where, and I'm just going to go back quickly just so I leave up the contact information. But this is where we normally see if folks have some very general questions we can address. And again, if you have more individualized or find, gee, I have many questions, I'd like to spend some time speaking with me directly, please feel free to contact me. But it looks like we do have a second question. Okay. And again, I will address the first question too. But we have a question. Did you say that a person could join an advantage plan up to 3 months prior to being eligible for Medicare? If so, does that mean if I am eligible for Medicare in March of 2023, that I do not have to have separate insurance for January and February and then enroll in an advantage plan to begin in March? And that I can have the advantage plan from January 1st seamlessly, even though my Medicare begins in March? And that's a very good question because there is confusion with the language. And basically, what it means is individuals are eligible, as we know, to have their Medicare A and B start for the month in which they turn 65. They can start the process to sign up for the A and B up to 3 months before, but the A and B can't start in this case till March 1st. So you are not able to actually enroll in an Advantage plan for January and February. The soonest the individual could actually enroll would be for March 1st. Again, they can start the process, meaning they can do a telephone enrollment. They can mail paperwork in. They can call and do a telephonic enrollment up to 3 months before, but the plan wouldn't actually start till the same day that the A and B does on March 1st. So the 3-month time frame they give you before your birthday is just to make calls, handle paperwork, fill forms, but the Advantage can't start till the A and B starts, and it never starts before the individual's birthday month, if that makes sense. Now, the other question that I see that I'll just go back to, the person indicating the difference between in-network and out-of-network for a PPO. So I can speak specifically to Health New England's plan, and that is under Health New England's plans, you have an in-network copayment column, and that's when you'd be using all the providers that are within the network in Western Massachusetts. Out of network would basically be any provider that is not within the Health New England network. And here in the Massachusetts area is where the copay would be a little bigger. Now, we actually have snowbirds that take our PPO plan and are down in Florida. And if the provider agrees to accept our PPO, and that's very important, we offer a PPO, but we can't mandate a provider take it. Many do, but the individual does need to check with the provider. But if the provider accepts our PPO, whether it's here or in another state, they now have access to use that provider. But if it's in another state, they pay the in-network copay. This is something very specific to Health New England called our travel benefit. And again, it's kind of confusing, so I'd be glad to go in much more detail about our specific PPO. It's a little different. And we actually have some additional materials which explain the PPOs. But I'm seeing again another question, which is, if enrolled in the Advantage plan, can a person still enroll separately in a private dental plan? And if so, would that have to be done through MA Health Connector? And that's a very good question, because the most common question we hear, gee, I don't see the dental coverage built into any of these plans. Plans may give an additional fee towards dental or reimbursement, but as far as an actual dental plan, you most certainly allowed to purchase a private dental plan. If the Advantage plan you choose gives you some type of reimbursement or allowance, you can use that in conjunction with the leftover balances from a dental plan. You can't use the reimbursement towards the premium of a dental plan, but if you're receiving extra leftover balances from a dental plan, you can use it most likely under the Advantage plan that you've bought to submit for those balances. I'm not sure about the connector website. I do know there are some carriers that offer senior dental plans, or some providers allow you to COBRA the current dental you might have. But again, that is something that would be up to the employer directly. Next question. I am retired, but husband is working. I opted to wait and am on his plan. When we retire, can we elect different additional plans? And the answer to that is yes. Once someone has both Medicare A and B, quite frankly, there is no more joint Medicare plans or family or husband and wife plans. Everything becomes separate, which actually works out to be much more accommodating because one spouse may feel more comfortable perhaps taking a supplement plan based on their needs, medical needs, and the other may say, I feel the Advantage plan may fit my needs better. So again, yes, you take separate plans once you leave that employer. Or again, if the plans you're looking at, you find that the same plan is a good fit, then it's just two separate enrollments into that plan. So I hope that answers your question. We certainly realize this is quite a bit of information, especially when folks are first starting. So if you have, again, much more detailed questions, I certainly, as I said, have my contact information up. Also, if you would like Health New England's plan specific, what our Advantage plans look like, what our supplement plans cost, some of the extras, please feel free to outreach to me. I'll wait just one more moment just to see if we have, again, any other questions. You're seeing my email address. So again, if you would like today's information, again, this is specific to 2022, I would be glad to send this. In addition, if you would like perhaps Health New England's 2023 plan information presentation, I'd be glad to send that as well. But I'll hold off another moment just to see if we, again, have any other general questions.
Great job, Kerry.
Oh, thank you, Sue.
Thank you so much for that great presentation. Oh,
is there one more? I think I see one more. I'll just open that up here. Let's see. Oh, okay. Yes. So she is indicating how do we get today's slides? And again, you're seeing my email address here, Trotta, Trotta, @hne.com. And quite frankly, if you would like to email me directly within moments, I can go ahead and provide today's presentation. And if you would like, and you indicate in the email, I can send you, if you're leaning more towards 2023 information, I'd be glad to attach that specific presentation that will only have Health New England's plan information on it. But again, I'd like to thank you everyone for joining us, and I'll hand it back over to Sue.
Thank you, Kerry. And thank you for everyone who joined us today. And we appreciate your time. Kerry, thank you for your time and expertise.
Oh, yes, my pleasure. Everyone have a wonderful day.